Now that we have talked about the anatomy and physiology associated with the digestive system, let's now discuss pathologies. Starting with the oral area, the mouth area, oral and lip cancers. The main causative factor of oral and lip cancers can be excessive exposure to sun or use of tobacco products. Tobacco in combination with alcohol is particularly bad. Alcohol will act as a solvent, making it easier for the carcinogenic substance in tobacco to be absorbed into the body. Leukoplakia is a precancerous condition of the mouth. It is characterized by white patches of tissue in the mouth. Patches or plaque, plakia, leuko, white. It's usually associated with the use of chewing tobacco and also increases the risk of cavities due to the fact that it contains sugar. Gingivitis is inflammation of the gums leading to tooth loss and generally due to poor dental hygiene. Signs and symptoms include sore, bleeding gums and a receding gum line. Treatment for gingivitis includes a proper diet as well as good dental hygiene. It is important to note the mouth is a site for many infections to infiltrate the body easily, especially a concern for patients who have myocardial complications. The mouth is a vascular-rich area. The mucous membranes are very thin, and there's a lot of blood vessels in the mouth. So if bacteria or other microbes get into the bloodstream in the mouth, they pretty much just drain straight down to the heart. There isn't much in line for filters in the immune system to take those particles out. So it can be damaging to someone, especially if they already have heart complications. Pyorrhea is a discharge of a purulent material from dental tissue. So it's kind of like pussy coming out of the gums. Symptoms and signs include pain and a very offensive odor. Treatment is to correct the source of the discharge, usually an infection with antibiotics if it's a bacterial infection, and maintain proper oral care. An abscess could cause pyorrhea. Now, common symptoms of digestive system disorders usually include some or all of the following: vomiting, diarrhea, constipation, and abdominal pain. Vomiting is a protective mechanism. It helps rid the digestive tract of irritant or overload of food that stimulates sensory fibers, sending a signal to the vomit center in the brain. That's known as the CTZ, or the chemotrigger zone. Motor impulses send to the diaphragm and abdominal muscles to contract, squeezing the stomach muscles and cardiac sphincter at the esophageal opening, and the contents are regurgitated. That's known as emesis. Diarrhea results when fluid contents in the small intestine are rushed through the large intestine without reabsorbing enough water. Rapid movement reduces nutrient and electrolyte absorption and can cause serious problems. Also, it can affect the absorption of medications. Just like it can reduce the absorption of nutrients, it can affect and decrease the absorption of medications. Diarrhea can be treated with antibiotics if it's being caused by an infection or a microbe, or it can be treated with antidiarrheal medications, things that will slow down the movement of the intestine so that there's more time for the water to be reabsorbed back into the body. Now, constipation is pretty much the opposite of diarrhea. If the waste products are moving too slowly through the colon, it will continue to absorb the water out of the feces, and the stool can become dry, hard, and difficult to pass. Does not refer to the frequency of defecation, but rather the hard consistency of a stool. A kind of interesting note, if you could think of it that way. Most people think that it's important to have a bowel movement daily, but For some people, depending on their diet and their lifestyle, they can have normal bowel movements every 2 to 3 days and still be considered normal and healthy. With constipation, there may be overstimulation of the musculature of the intestine, creating more narrow passageway for material, or the musculature has become flaccid or doesn't really work, or very slow, and is often found in a bedridden geriatric patient. To treat constipation, one of the most important things to prevent and treat constipation is proper hydration. If you're dehydrated, you're not going to have enough water to absorb back to begin with. We can also use laxatives, which include things like bulk-forming laxatives, which are fiber supplementations, to give bulk to the feces, as well as bring in fiber, which will bring water back into the colon. We can also use stimulant laxatives and osmotic laxatives, which will cause, again, it's full of electrolytes, so it'll bring fluid into the colon. So there's a number of different types of laxatives that can be used to treat constipation. Dietary changes with more water and liquid, reestablishment of regular bowel habits, and moderate exercise to help to contribute to the condition. So lifestyle changes can also be effective in treating constipation. Now, be warned that chronic use of laxatives and enemas should be avoided and may aggravate existing conditions such as hemorrhoids or create new ones such as injury to the mucous membrane of the intestinal lining. Also associated with many of the digestive pathologies is abdominal pain. And the pain can be sharp, dull, localized, diffused, radiating, occasional, or constant. Diffused would mean that it's kind of in an area where you wouldn't think it would be. Radiating means that it's intense in one area, but it still has pain in others. Severity of the pain does not always indicate the severity of the disease. Large amount of flatulence or gas can be extremely painful, but once it's released, much more comforting. Stomach cancer may initially present with relatively mild form of indigestion, and any pain from the GI tract should be investigated. So disorders include things like GERD, which are known as gastroesophageal reflux disease. It's a condition where the acid stomach comes back up to the esophagus. It flows backward. It has a reflux. Since the esophagus does not have the protective mucus that the stomach does, it can cause inflammation and ulceration of the esophageal tissue when the stomach contents come back up into the esophagus. As a result, scar tissue can eventually form, causing a narrowing of the esophagus. And if left untreated, the constant inflammation can actually lead to esophageal cancer. The cause of GERD, the erosion of the esophageal lining due to acid reflux, often due to weakened lower esophageal sphincter. Other causative agents include overeating, lying down too soon after eating, obesity, alcohol, caffeine, and chocolate consumption. Signs and symptoms of GERD are heartburn, especially after a meal, and often during recumbence. Diagnostic tests, the patient's history, an exam, perhaps a gastroscopy, and a barium study. Treatments, treat what's having it cause. So if you're having GERD because you drink too much caffeine, cut back on the caffeine. But other things that can be used to treat GERD include medications like antacids, which reduce stomach acid production. Also other medications such as proton pump inhibitors, that's something like Prevacid or Nexium, or an H2 blocker like Zantac or Tagamet. Also changes in timing of eating and the types of food that are consumed. Avoidance of chocolate, peppermint, coffee, citrus, fried or fatty foods, tomato products. All of those food products could exacerbate GERD. Eating smaller meals more frequently instead of a huge meal. Also, quit smoking. That's important to treating GERD. And then try to avoid laying down for at least 2 to 3 hours after eating. So the contents of your stomach can start processing through to your intestines. So if you lay down, it doesn't just want to have a retrograde flow. Now, one of the complications of GERD is a condition known as reflux esophagitis or erosive esophagitis. And this is caused by that stomach acid backing up into the esophagus, causing that inflammation and pain. And it's very similar in GERD, but it's more serious. Heartburn is a symptom. It has a continued erosion of the tissue of the esophagus that leads to that scarring and stricture and difficulty swallowing, and potentially leading to esophageal cancer. Treatment: reduce the reflux through smaller meals. Stop eating about 4 hours before going to bed. Quit smoking. Avoid alcohol, caffeine, and chocolate. Elevating the head when sleeping. And avoid sleeping on the right side of the body. Utilize medications that decrease gastric activity, such as proton pump inhibitors, such as Tagamet or Cimetidine, and even surgery in extreme cases. Moving down through the digestive system, the next disorder are ulcers. There are different kinds of ulcers. So first, a peptic ulcer is a breakdown of the mucosal membrane in the esophagus, stomach, or small intestine, developed most commonly in the duodenum. That may also be referred to as a duodenal ulcer. Factors that increase the risk of developing a peptic ulcer: Helicobacter pylori, or what's known as H. pylori. It's a bacteria that causes an infection in the stomach. It leads to gastritis and initial erosion of the mucosa. It is worsened by exposure to gastric juices. Other things that can cause ulcers: smoking. Again, it inhibits the production of the bicarbonate, which would help to neutralize the chyme. So if it's not there, it could cause a higher acidic chyme to be in contact with the duodenum for a longer period of time, damaging that epithelial lining. Heavy or chronic alcohol consumption. Alcohol is a gastric irritant. Use of nonsteroidal medications such as aspirin or ibuprofen or naproxen. This is a twofold piece with ulcers. Your nonsteroidals as well as your steroids, which is the second one down on the list, use of corticosteroid medications. One of the things that makes these drugs so effective as anti-inflammatory agents is they block prostaglandins, that mucosogen in the stomach that helps protect the stomach and that mucous membrane is made with prostaglandins. So these agents will actually stop the stomach from protecting itself. Now further, with an NSAID, those drugs are also gastric irritants. Caffeine consumption. Caffeine is a gastric irritant. And also stress. Stress can cause an increased production of the stomach acids. Patients with duodenal ulcers tend to have overproduction of gastric juices, or what we call hypersecretors, a rapid rate of gastric emptying, and together these expose the duodenum to more acidity. Lower than normal gastric acid, possibly due to a weakened pyloric sphincter, allows the duodenal contents to squirt back into the stomach, and then also conditions that can lead to defective gastric mucosa. So here we have an illustration of some ulcerizations. So the gastric acid comes from the parietal cells, and we've got the food down here churning up with the chyme, but here we have a sore, and that's caused by H. pylori bacteria. So it's an open wound, and then the acid gets in there and it starts eroding away, and we break through the layers of the stomach, and actually they could bleed. Over here we have a picture of a duodenal ulcer. This is actually an ulceration. Kind of think of it if you've ever had a canker sore in your mouth. Maybe you've eaten some tomato product or pineapple juice or something that caused an irritation, or you scratched the inside of your mouth and you get a canker sore. That's kind of what's going on down in the belly. This is talking about, this one is GERD, where we have the reflux coming back up, and then peptic ulcer disease, or PUD. Gastritis is another condition affecting the digestive system. It's irritation of the stomach. It's acute or chronic inflammation of the stomach due to infection, can be spicy foods, excess acid production, stress, alcohol, aspirin, heavy smoking. Signs and symptoms include pain, tenderness, nausea, and vomiting, and treatment include antacids and antibiotics if it's caused by a bacterial infection. Gastroenteritis is an infection or an inflammation of the stomach and the small intestine due to virus or bacterium. The source may also be chemical in nature. Signs and symptoms include abdominal pain, nausea, vomiting, diarrhea. Dehydration may also result as a complication. And in treatment, we use antibiotics if it's a bacterial infection, antiemetics, and antidiarrheal drugs. Irritable bowel syndrome, which is known as IBS, is a disturbance in function of the intestine from an unknown cause. Often seen in young to middle-aged females, may be stress-related, may also be due to laxative abuse or irritating foods. Signs and symptoms include abdominal discomfort, pain, bloating, and altered bowel activity. IBS-D is irritable bowel syndrome with diarrhea, and IBS-C is irritable bowel syndrome with constipation. Treatment includes lifestyle modifications, dietary considerations, as well as medications. Inflammatory bowel disease, or IBD, is different than IBS. IBD can include Crohn's disease. Inflammatory bowel is inflammation of the bowel. Its signs and symptoms include abdominal pain, bloody diarrhea. If severe, can cause a low-grade fever, weight loss, fatigue. Blood results may show iron deficiency, anemia, as well as leukocytosis. Treatment for inflammatory bowel disease is with medications, primarily anti-inflammatory agents such as sulfasalazine, which is a zolpidem, and immunosuppressant drugs. May also require surgery. Crohn's disease is a type of IBD. It is a form of chronic inflammatory bowel disease affecting the ileum and or the colon, and is also called regional ileitis or enteritis. Signs and symptoms include pain, cramps, diarrhea, bloating, and weight loss. This is also treated with anti-inflammatory medications, can be using steroids to suppress the inflammation like prednisone, as well as surgical intervention. Diverticulosis or diverticulitis is inflammation and infection of the diverticulum or the sac in the intestinal tract, especially in the colon. Signs and symptoms include bleeding, abdominal pain, fever, hyperactive bowel sounds, muscular hypertrophy, shortening of the colon due to muscular hyperactivity, inflammation, and pelvic abscesses. Treatment: a high-fiber diet helps keep the colons clean, stool softeners, antibiotics when an infection is present, and it may require surgical intervention. Ulcerative colitis is ulceration of the mucous membranes of the colon, often of unknown origin, but may be caused by autoimmune conditions and stress or food allergies. Signs and symptoms include inflammation of the region, lesions, decreased flexibility of the bowel, fistulas, abdominal pain, chronic diarrhea, fever, weight loss, bleeding, anemia, malabsorption of nutrients, and ulcerative colitis could lead to cancer, colon cancer. Treatments may include surgical intervention or treatment with anti-inflammatories and possibly antibiotic medications. Colorectal cancer is a common cancer that is very treatable if detected early. Risk factors for colon cancer include a genetic predisposition, a diet rich in animal fat, a diet lacking in the appropriate amounts of fiber and calcium, tobacco usage and excessive alcohol consumption, higher than normal levels of bad cholesterol or LDL in the serum, and a sedentary lifestyle. Screening for colon cancer, we use a colonoscopy. It is a modality of choice. A barium enema with imaging studies can also be used, although is much less accurate. Then we have hemorrhoids. Hemorrhoids are varicose veins in the rectum. They are often caused by chronic straining to evacuate the bowel or obesity. They are also quite common during pregnancy. Signs and symptoms of hemorrhoids include pain, itching and burning sensation in the rectal area, as well as bleeding. Treatment, dietary changes, including more fiber and more water, may also use stool softeners and medication such as Tux pads to help relieve the discomfort. That Tux pad is active ingredient is witch hazel, which is a astringent. It shrinks the blood vessels. Malabsorption syndrome is an inadequate absorption of nutrients from the intestinal tract caused by a variety of diseases and disorders of the pancreas or the gallbladder. Signs and symptoms include malnutrition, failure to thrive, failure to absorb fats or other nutrients, abnormal stools such as black and tarry or pale and floaty, and a foul odor. Treatment, treat the offending disease, dietary adjustments, and include supplemental vitamins and minerals when indicated. A hiatal hernia is a protrusion of the stomach through the diaphragm and extending into the thoracic cavity. Reflux esophagitis is a common symptom, more common in women. Incidence increases with age. Signs and symptoms of a hiatal hernia, they may be asymptomatic or heartburn within 1 to 4 hours after eating and having esophageal reflux. Treatment is similar to GERD, with frequent small meals, loss of excessive weight, elevation of the head of the bed, cough suppressants, smoke cessation, antacids, and avoiding sleep on the right side of the body. Hepatitis is inflammation of the liver. Its possible causes are exposure to infectious agents like hepatitis virus, or exposure to toxins like alcohol, or exposure to certain drugs like acetaminophen when taken in excess. Signs and symptoms of hepatitis are chronic hepatitis, usually diagnosed by elevation of liver enzymes in the blood, whereas acute liver disease may be characterized by jaundice, enlarged liver, altered mental status, and possible multi-system failure.